Hello there, this is Subrata Banerjea welcoming you to a presentation of Miasmatic Prescribing. It's a very vast topic. In a very short time, it is very difficult to present that, but I will take you through pictures. I'll make you understand the miasm so that you can really incorporate miasm in your practice in every day, which I do. Miasm is a topic which should be incorporated with the totality. I always say miasm and totality comes together, and that's very important. I will take you through the keywords of miasms. The keywords, the way I present, Sora is the blue, which is the cold color, and lax, scanty is the keywords for Sora. Hypo is the keyword for Sora. Whereas yellow is psychosis. Hyper is the keyword for psychosis. And the psychotic miasm is manifested with excesses. The psychotic miasm is manifested with incoordination. That could be physical, that could be mental. So physical incoordinations are tumor, whereas mental incoordination is excess manifestation of jealousy, excess manifestation of suspiciousness, etc. I'm passing on to the red color, and you understand red is danger. So we have syphilis, and syphilis is the danger miasm, which is related to destruction. Destruction, disintegration, all relates to syphilis. Pus formation, necrosis, that's your syphilis. Whereas in the mental sphere, that destruction is love for one's own life is destroyed, suicidal, and that's syphilis. And the combination of Sora and syphilis gives us the purple color here, and that's the tubercular miasm, related as dissatisfaction. Also, alternating behavior, periodic behaviors, these are tubercular miasm. I have had the privilege of descending my homeopathic blood through 4 generations, and my great-grandfather studied with John Henry Allen, who has given us this tubercular miasm. I am presenting you through pictures some of the interesting aspects of this miasm. The first, here you see the sterile philosopher, which is related to hypo or lack of practical sense. They have lots of ideas, but they cannot manifest those ideas, and that's your Sora. Passing on to the next, which again lots of ideas, but hypo depth, lack of depth, and that's interesting. They build castle in the air, but they do not have the depth. So lack of depth here, that manifests as Sora. Look here. Interesting pictures, and you could see the untidiness of Sora. And how I will say this is Sora? Because lack of sense of tidiness, hypo-tidiness. And also you can explain that as an indolence. So lack of stimulation to clear up, and that's your Sora, lazy, untidy. Your Sora have various fears. And how these fears are Sora? Because there is anxiety in the background, and also the lack relates to that anxiety, lack of courage, and that's resulting fears. We have school-going fears, we have fear of failures, and that's your Sora. Here comes the color changes. So we have psychosis, the loud color, the yellow color. They are deceitful, they are sneaky, they are sleazy. These are the incoordination of behavior. If you remember your Thuya, which is one of our leading antipsychotic, you have that sneaky behavior, you have that sleazy behavior, and that's incoordination in the behavior, and that's interesting in psychosis. But again, psychosis can be manifested as excess. So here excess, over the top tidy, fastidiousness, and that we have it in arsenic, we have it in carcinosin, we have it in pulsatilla, we have it in graphitis. You see this interesting aspect of over cleanliness, fastidious. That's your psychosis. Restlessness. Dear friends, mental restlessness is Sora, whereas here you see in the picture is a physical restlessness, which is psychosis. Because I said hyper is psychosis, so you could see the hyper excess in behavior. Mentally destructive. The color changes. Here is red, So destructive, mentally destructive. You could see cold-blooded murderers, the cruelty, and these are all your syphilitic taint. Suicidal, love for one's own life is destroyed, and that's interesting. That's syphilis as well, because the destruction in terms of love for its own life. Introvert, love of socializing is destroyed, and we have melancholia. So melancholia is syphilis, depression is syphilis, which I will come later on. Destruction of joy and hope, and that results the depression. You see, I will always present miasm as a formula, because if you understand those keywords I have presented in my book on miasmatic prescribing, I have elaborated those keywords, and here as I am sharing with you, the destruction is the keyword for syphilis. So through destruction you understand the nature of the presentation. Dissatisfied, fearless, impatient and stubborn behavior, and that's your tubercular. Because I mentioned dissatisfaction, and the other aspect is the less fear, fearlessness. The destruction of syphilis joins here, and lack of fear of sora joins here. You see, the tartar in tooth are interestingly sora, and that's a very important character, and this is due to the lack of cleanliness. I will present it as a lack of cleanliness. You see the ulcerations of syphilis, destruction, ulceration. So we have cracked, fissured tongue, we have ulcers, and that's your syphilis. Caries in teeth. Look at this destruction of the teeth, and that's the caries, and that's your syphilis. So that's the syphilitic miasm manifested as destruction. We have the pyuria. I mentioned previously destruction. So pus formation, destruction, and that's your syphilitic miasm. Pyuria is a discharge of pus. I like to present the miasm in terms of looking at the skin and diagnose the miasm. Dry, unwashed appearance. The dryness is sora. How will you say dryness is sora? Lack of secretion, and that's sora, and that's interesting. Here you see the dry, harsh, rough skin of sora, and that's the roughness, once again related to the lack of secretion, hyposecretion, and that's sora. Psychosis, excess, proliferation, hyper, incoordination, and edema. Edema is, interestingly, I can say it's an incoordination. On the one hand, it is a hyper or excess, and on the other hand, it's the incoordination of the absorption of the fluid. So that's edema psychosis. You see these words, condylomatous, these are all interesting manifestation of psychosis. Thickened skin. Whenever you look at the skin, thickening of the skin, this is a clear, thickened, elevated skin, that's of psychosis. Interestingly, dear friends, circular appearance is psychosis. Here you can see in the skin, the appearance is circular, circumscribed, and that's psychosis. Water retention, edema, and that's once again, if you look at that, that's excess of water, so psychosis, and also incoordination of absorption, so that's psychosis. Vesicular eruption, whenever we will find fluid underneath the skin, and that's psychosis, and that's important. Keloids, you could see over here, that's the growth, and that growth is hyper, and that hypertrophy or hyper or excess of deposition, and that's psychosis. This lymphedema, that's again swelling, excess, psychosis. Hyperpigmentation, from the word you understand this is a hyper, so hyperpigmentation is psychosis. If we find destruction of pigmentation, that will be syphilis. In the syphilis, three things are very, very important, which I like to point out in this short presentation: degeneration, destruction, and ulceration. And these three are very important, which I will show you in the pictures. There is pus formation here, and the pus formation is syphilis. There is abscess, all boils with pus are syphilis. Here you see athlete's feet with cracks and fissures, sometimes oozing, that's syphilis. All fungal infections are syphilis. Here we have the ulceration. Many times we get ulceration in the mouth, we get aphthous ulceration, that's syphilis. Here we see the ulceration. Destruction, ulceration, that's syphilis. Here we again find an abscess, which is a suppuration. Suppuration is the destruction of the healing power on the one hand, and on the other hand, it's the destruction, disintegration of cells. That's syphilis. Here we have the destruction, as I mentioned, which is syphilis. Vitiligo, destruction of pigment. That's interesting. Destruction here. So there is whitening of the skin, and that's syphilis. In the tubercular miasm, three things I like to point out: allergic manifestation, periodic manifestation, and hemorrhage. These are tubercular miasm. In tubercular miasm, we have the allergy, all allergies. It could be a milk allergy of the child, or it could be a food allergy of the adult, or it could be an allergic bronchospasm. That's tubercular miasm. Ecchymosis, hemorrhage are tubercular. So hemorrhage under the skin, eczema, especially in the flexural surface, like back of the knee. If you recall your tuberculinum, they have the eczema in the back of the knee, in the elbows, etc. That's tubercular miasm. Here we have hemangioma, which is the oozing of the blood, blood tumors, and that's blood related, so it's a tubercular miasm. Varicose vein, related veins, and that's the reason it is a tubercular miasm. Sometimes it could be tuberculopsychotic because the proliferation is psychotic. My last aspect of this is the nail and miasm. There's a story behind it. I learnt it from one of my Guruji, who is to diagnose, look at the nails and diagnose the miasm and quickly combine the miasmatic diagnosis with the totality, and used to prescribe wonderfully well. Dry, harsh nails, and that's psora, because the dryness is psora, whereas the ridges, wavy nails, thickened nails, and that's psychosis. Here we get the ridge, and that's psychosis. Here you see the interesting aspect, the thickened, elevated nails, and that's psychosis. Thickened nails. You see the thickened nail, proliferation in the nails. As nail is a variety of skin, so we have that. You see here the destruction of the nail, fungal infection of the nail, and that's your syphilis. Spoon-shaped nail is syphilis. And with this I end a short presentation of the miasm. Combination of the miasm with the totality of the symptom makes the best prescription, and which I have elaborated in my book and in many of my seminars. I always say this is the most classical, consistent, surest, scientific, and time-tested method of combining miasm with the totality and prescribing each and individual case. Thank you very much. Long live Hahnemann. Long live homeopathy. Thank you.